I'm going to get us started then. So thank you everyone for coming. I'm Sarah Smith, the Director of Public Affairs at the Office of the Commissioner of Insurance. This is the DHS OCI Healthcare Coverage Partnership Forum that is typically quarterly. We did miss the last one because we were waiting for the public health emergency unwinding to sort of develop a little bit further. So we're glad to talk a little bit more about that today and get an update on how that's all been going. So first for the agenda, so I will have a very quick agency update from OCI, and then we will get into a PHE unwinding update from DHS, go into our work group reports, and then talk a little bit about unwinding and open enrollment marketing from our marketing and promotions work group. So for a quick OCI agency update, just wanted to flag, and I think it will be probably mentioned later in the presentation as well. PHE Unwinding Communications, OCI has a toolkit, and we are posting the toolkit on our own social media as well. Oh, I hear my audio is quiet. I will try to project a little bit more. Hopefully it can get picked up. So the PHE Unwinding Communications is something that OCI is supporting and will continue to do so. And if you want to find our toolkit on that, we can put a link in the chat later in the meeting. And the unwinding agent training is another thing that OCI recently did with DHS, Baltic. I see I have a typo there, and covering Wisconsin. And we really appreciate those agencies for partnering with us to conduct this training for agents. This was an opportunity for us to just remind agents about the public health emergency unwinding and what that would mean for them in terms of enrolling consumers into new health coverage as they may be losing their Medicaid coverage. So that was a good opportunity, and we had over 100 participants in that, and we will be putting up a recording of that soon. I know some of you may have been in that training and are looking for that recording. We had some issues at the end of the training, so we're re-recording the OCI portions to make sure we have them in their entirety, and then we'll be editing those pieces together to make sure that whoever watches it will have the full scope of the issue in that recording of the training. And then finally, just a plug for our Wisconsin insurance news. So OCI puts out a agent newsletter, so it is sort of targeted to insurance agents, but has a lot of general information as well about sort of the state of the industry, what OCI has been up to. And so I would encourage anybody who would like to stay in the loop on the latest regulatory approach from OCI or the latest information about the outreach that we've been doing by enrolling or signing up for that. We put them out sort of seasonally, so our summer edition will be coming out soon. If you go to oci.wi.gov/win, you'll be able to see previous editions and also sign up for future ones. So now we will get into the PHE unwinding update from DHS, and I believe I'm handing it to Jamie Kuhn to walk us through this update.
Hey everyone, good afternoon. Can you hear me okay?
Yes, we can hear you.
Great. Well, a couple of items, as you all know, the 1.6 million individuals who are going through the process of redetermination or renewal over the next 12 months has begun. Thanks again to all of the partners and individuals who are participating in this process and working with our members to make sure they have the most up-to-date information. One of the things that we all keep saying and is really true is that this is an opportunity at a minimum to make sure we are all working together and working for the same purpose. So this has been a great experience with our partners. I know that there's so much more work to be done. We meet, regularly with a group of stakeholders. In addition, there are many other ways in which you can engage in this process and or participate. As you go to our website, there are lots of ways to plug in, groups to join to get information and downloads, but I really want to highlight that we have again, a lot of information available at our webpage. We are talking with folks about their renewal period and making sure that they are renewing at just the right time in their renewal month. We have partner toolkits that individuals can use in multiple languages. We are asking stakeholders and partners to, again, remind people wherever possible to watch, read, and act. We have a new outreach card that people can use, providers can use as well, partners and providers can use, that includes a QR code. So if you're in spaces where there isn't a lot of time for conversation, but you want to make sure that this information is available and accessible to everyone, please go to the site and download that card and post anywhere and everywhere. And again, asking people to be creative and thinking about other ways in which we can communicate with our members. Our big news for the week is that we have posted a data page at DHS to talk about the unwinding data from previous months. And so as we just got through June with June numbers, you will find on that page the information about enrollment and other renewal initiated information on that page. So I'm going to just, Sarah popped it up in the chat, so feel free to go look at it. I just want to give you a couple highlights of that page to make sure that you understand. And one of the things that we have been working really, really hard with individuals who are seeking information on our enrollment numbers, as well as having conversations with our friends and family across the state. It is really, really, really important to not make assumptions about this data. We do not want to obviously assume anything about why individuals may be going through the renewal process or why they may not. I think we can all guess, but we want to make sure that as we get more information and as we go through this process, that we are being really thoughtful about what this data means, how it can help us in the coming months, and making sure that we are continuing to do what is most important, which is to talk to our members and make sure that even if they are no longer eligible for Medicaid, that they have another way to talk to individuals about their options. And we so appreciate our partnership with Covering Wisconsin, who is also helping us do that work too. So just a really quick couple of items, key takeaways from our data page. The new web page shows enrollment figures, as well as information about renewals that are due and renewals initiated. So this first snapshot is really, the first snapshot on the webpage is really about our Medicaid programs and the number of members as of April 2023. We go into May, and as many of you understand and know, this May grouping was our IC only population. We were aware that many of them may be ineligible and that they were needing to go through a reapplication process. So we did understand and anticipate that it would trend downward in the month of May. And then we move into June, where we have started our 12-month renewal process. And as you will see on the website, when you look at it, there's a column for renewals due and renewals initiated. So that April 2023 starting point is really our baseline that we're working from. And just to, again, give context to data as we move forward in this process, as you all know, the context is really important. Renewals due is the number of members who were scheduled for renewal that month and received notification from DHS that they needed to take action. Renewals initiated in our data is the number of members who choose to take action on that renewal, regardless of the status in processing or of that renewal in that point in time. So as we discuss data, we also need to remember that it is a snapshot in time and that things will change and continue to change as we move forward. And so we will be updating this data on the third Thursday of every month. And again, it will be a snapshot in time. And so it is important for those who want to follow along. As we go into August, if there is any new information we have received about June, that June number will and potentially could change from when we posted it in July. So again, just so you know, we will be posting a number each month on the third Thursday. So for August coming up, we will be posting information for July at a snapshot in time. It is possible that the June numbers will have changed since we posted it this month due to additional processing for members whose renewals were due in June that have gone through the rest of the process, or others that re-engaged through that reconsideration period that CMS is allowing us to have for 3 months of late renewal. So that is sort of our big update as we look to that information to be a place for public transparency, information sharing. But again, just want to make sure that everybody really looks closely at that data and makes sure how important it is to not make assumptions about what that data may mean, because it could change over time based on what is happening, as you all know, in this ever-changing world of unwinding. And we really appreciate, again, everybody's support in outreaching to members. That is the most important and most valuable thing that you can do right now, is ensure that in every way possible, we are using all of our creative ideas to post that information so individuals have access to that. So that's my update for the month.
Thank you, Jamie. I don't see any questions in the chat, so we'll move on. And we're getting into the work group reports next. So first we will go to the data work group and Kelsey Avery.
Hi, everyone. It's been a little while since the last partnership forum, and a bit longer than that since we've covered what will be in the health coverage in Wisconsin dashboard. And since this dashboard is currently in post-production testing in preparation for becoming publicly available, I thought it'd be helpful to quickly remind folks about some of the specifics. So as a reminder, this dashboard will be hosted on OCI's website. It's going to include interactive, user-friendly visualizations that provide Wisconsin-specific data on health coverage. And there are a couple data sources that will feed this dashboard. The first is Small Area Health Insurance Estimates, or SAHI, data from the Census Bureau. And that provides high-level information about people who are insured or uninsured across all Wisconsin counties. Second, there's data from the American Community Survey, which is also from the Census Bureau. That includes enrollment by source of coverage and various demographics. And then finally, there's monthly data that's collected by OCI on the fully insured individual and group plan market. And that's going to be provided either at the county or at the rating area level. And so, as I mentioned right out the gate, right at the top, dashboard is currently in post-production testing, and we are looking forward to rolling it out to all of you soon. Thanks.
Thank you, Kelsey. And next we have the workforce work group, and we did share a read ahead for this work group. But Bobby, I didn't know if you wanted to comment on that or give any context to that read ahead, or
Sure.
Ask any questions of the group.
Yes, I can just give a quick report on the workforce group. The workforce group is focusing a lot on many of the implementation issues between community organizations, IM agencies, some of the areas that, we've been meeting ahead of the unwinding and now during the unwinding to really look at troubleshooting issues. There's a group of about 30 that include a mix of some state folks, county IM leads, myself, and a few other advocates, just going through and identifying some of the key areas where we expected to see trouble, where we're identifying issue areas. We're also identifying, best practices and opportunities where people are getting able to get through and cut through some issues and trouble spots. And so that's been pretty gratifying in terms of having a chance to meet with the IM consortium, identify areas that some of our clients are facing barriers or, just confusion a lot of times. And so cutting through the red tape is, it's been a very good and positive experience, I think, for everyone. I think we're continuing to meet. We're going to continue to meet during the unwinding. We're identifying other issues, and I encourage people to report some of these issues that you're seeing. And because we'll have an opportunity then to look at some of the ramifications of these issues and how to, do our best, as Jamie said too. We're trying to make sure that people don't lose coverage during this process, and the more we can do together as a community, helping to raise awareness and look at some of the snags that people are seeing and helping to identify opportunities to reduce those snags as much as possible, mitigation strategies. Some of our discussions involve, access and using the app, trying to facilitate information out to people so they know their renewal date, working with families, friends, and relatives to try and make sure that they are helping and engaged with recipients so that they're working to troubleshoot and identify some of these issues as well. And then simply just, our best efforts to share information within our networks so that we're getting the word out to as many as possible. That's all I have. Thank you.
Thanks, Bobby. And next we will go into the outreach, education, and enrollment networks. And I assume that's Carolyn?
All right.
Great.
Yep, that's thanks, Sarah. All right, so yes, I'm going to be giving the update on the outreach, education, and enrollment network work group. And I wanted to just give kind of an update on what type of progress we've been making since essentially about a year ago, we started reinvigorating the enrollment networks. So throughout the last year, 9 enrollment networks have worked toward the following goals. So to build enrollment network membership and develop a regular meeting schedule, share information to and from local community and state partners to get input, host speakers to present on key relevant topics, prepare enrollment network members to help people with enrollment assistance, and then discuss and highlight outreach strategies, which we'll talk about on the next couple slides, and then support the creation and dissemination of community relevant materials and promotion. So as you can see, a lot of the pieces that we're talking about across all of our partnerships, but outreach, communication, and enrollment assistance, and making sure that our partners who are providing that enrollment assistance or who are providing those messages have the right information and are working collaboratively rather than in silos. If we can go to the next slide, please. So I'm very excited to say that starting in August and or September, we'll be having our kickoff to our 10th official enrollment network, which will be in partnership with the new Hmong professionals in Appleton, Wisconsin. They will be our subcontract to host the first ever Hmong enrollment network. And so if anyone on this call today is interested in joining the Hmong Enrollment Network kickoff, please feel free to reach out to me directly and we'll get you connected once the official save the date is available. Next slide, please. And then what I wanted to do today was to go over just some of the fantastic outreach efforts that are happening across the state through our various enrollment networks. So as you can imagine, because we're representing different regions or different communities and populations, they all are they vary per the district or area that they're in or the communities that they're specifically trying to reach. And so I'll be highlighting just a few things that each group is working on. So in the Western Enrollment Network, who's led by Lindsay Swartz-Nichols, They've been sharing postcards in grocery and shopping bags at local food pantries, thrift stores, and other small businesses. They've sent Badger Care posters with the tear-offs to many different community-based organizations, including churches, and then throughout their enrollment network partners. And then they've been working collaboratively with a local health system to see how they can get some of the Medicaid renewal information in either exam rooms and or lobbies. So then in our Northwest region, which is led by Mike Rust from ABC for Rural Health, they've created a YouTube library of some brief 3 to 5 minute videos that feature topics around unwinding. And they've really have capitalized on using those searchable words through Google to be able to target certain communities, especially the counties that they're serving within their enrollment network. And they've really seen that that has triggered a lot of engagement from the communities that they're trying to reach. And then they've also contacted community education programs in their school districts to get this information out to families and kids. And they've seen many uptake their requests for materials and include a regular email to those community education directors or staff where they are sending out their social media either on the school websites, the school social media, and in many cases, the local government will get access to that information too. So it's casting a wider net every time they send that out to their enrollment network group. And then next we'll go to Northeast, and I have both Kirk Moore and Tony Lee. So Kirk Moore has been our lead for the Northeast, and as of this month is turning over the reins to Tony Lee, who's another one of our Covering Wisconsin staff. And Kirk will stay on for over the next year, but plans to retire over the next year. And so we're glad to have him for as long as we do, and Tony to take on the leadership of the Northeast REN. And one of the things that they've been working on is connecting with nonprofit and governmental agencies, particularly capitalizing on the relationship that Covering Wisconsin has with UW Extension, but to further build contacts with the various other programs outside of health that will allow us to be present in more locations across the counties that the Northeast represents. And so that includes going to the county fairs and providing promotional material there. And they also had a 5-week ad campaign that resulted in many different referrals to our enrollment assisters. In the East Central region, which is around the Fox Valley, Julia Garvey leads our enrollment network. And over the last several months and into the summer, they've offered presentations for the community hosted by the United Way and then the Multicultural Coalition. They've done a lot of outreach, building one-on-one relationships with community partners, which I think is the bedstone of this type of work, where you are actually learning more about the organization so that you can pull them into the work that we're already doing based on what their priorities are. And Julia's a master at that type of organizing and relationship building. And so they've maintained and distributed a material library where all of their enrollment network partners can actually go to partnership community health centers and essentially pick out the materials that they need for events that are coming up, or handouts they want to make sure that their community members or their clients want access to. And then they've invested in both digital and traditional media in their East Central region. Oh, and who's that? It's me. And so I lead the Southeast and the Southwest enrollment networks. And so these two are both very different. So in our Southeast region, we have regular community events hosted by our managed care organizations that we're invited to regularly through our enrollment networks. And then we've participated in a lot of bigger festivals and events like community baby showers in the general Southeast region. And those have high traffic, high access to community members and Medicaid members particularly. And so we've definitely been utilizing the options that we have. Whereas in the Southwest, those types of events are fewer and far between, but we engage with local organizations to share these resources. And we've been doing so through, of course, UW Extension partners, but then the Aging and Disability Resource Centers, community health centers, our agent and broker partners in the Southwest. And then the local community action program has been a huge connection to the community. One of our newest leads is Tina Marshallek, who is also our interim outreach coordinator at Covering Wisconsin. She leads our central enrollment network, and she's been building the membership by connecting with school districts, college and universities, ADRCs, senior centers, and of course, our UW Extension partners, to just name a few of the long list that's listed. We have a great relationship with the Madison Area Technical College, where they're placing outreach cards in each freshman orientation bag. And then we are working collaboratively with the Wisconsin Department of Children and Families to really reach out to resettlement agencies. And we've been doing a flurry of presentations to those groups that hit both the central region, but also statewide. And then to highlight Milwaukee, which is the Milwaukee Enrollment Network, we have Justin Rivas, who is the lead of the Milwaukee Enrollment Network. And then I also want to acknowledge Nicholas Duke, or Nick Duke, who is the Enrollment Assistor Workgroup Chair, which is kind of unique to the Milwaukee Enrollment Network, whereas they have a larger membership. So in order to have really fruitful discussions around enrollment assistance and outreach, they have this condensed group of people who are certified application counselors, navigators, agents, and brokers that come together and talk through their strategies of making sure that they are reaching their communities, but also are working on technical assistance because of the volume of cases and appointments that they have in the Milwaukee area. And so the Milwaukee Enrollment Network has their own Unwinding toolkit through Healthy MKE. They also have scheduled more than 60 plus events from May through August, and that number I can imagine is growing. We have our fantastic Cheryl Isabel at Covering Wisconsin, who has facilitated a lot of those relationships with community-based organizations to create such a volume of events. And then we have 88 businesses that have either flyers or posters within their organization related to Medicaid renewal. And then over 4,000 conversations have been already had in the last couple months about Medicaid at these various community events. And so, as you can imagine, the summer is only halfway gone, so we have plenty more to be had. And then sorry that this has continued, but this is actually specific to the Latine Enrollment Network, which is led by Lourdes Godinez, affectionately called Luli. And I'm very excited to share that they've built a very strong relationship with the Mexican consulate after requesting one of their representatives to present on the services that they provide to the enrollment network. And now they're connecting enrollment network members to the consulate, where they're going to have mobile offices or visits with some of the other cities across Wisconsin that serve the essentially Mexican citizens who live in Wisconsin. And Luli has requested different lawyers and experts on immigration to answer various enrollment network questions around immigration process and how it is connected to Medicaid enrollment and health coverage enrollment. And then, of course, a lot of the members in the enrollment network, this particular enrollment network, are very connected to their local media community. So there's radio shows and other television ads that are happening in Spanish across the state to make sure that this community is reached. So then those are the outreach updates. One last thing is that we are going to Covering Wisconsin is going to be doing our next round of community mobilizer mini grants, which provides up to $4,900 to organizations that aren't necessarily doing enrollment work, but are very well positioned to help get the word out. So they're the ones that have clients that may be Medicaid members or may need health insurance, may be uninsured, and they can easily reach them because they're already connected to them for other priorities or whatever work they're helping in the community with. And so if you are interested or know organizations that might be interested in supporting this work, please contact Tina and she can give you a proposal template. And we're looking to have proposals come in by August 31st for this next round. Once again, here we all are. If you want to join one of our enrollment networks, please, you can follow the link attached to the presentation. Otherwise, please feel free to reach out to me and I can get you to the right place. Thank you so much.
Thanks, Carolyn. All right, now we are on to the marketing and promotions work group and Stephanie.
Thanks, Sarah. Go to the next slide. Okay, so I wanted to give you a little bit of background about what we're doing when we're meeting so that when I start showing you the output, you know how that came to be. So the group has really been creating and coordinating unwinding messages and promotions across state agencies, partners, and the state Navigator agency. So we're all coming to the table and we're talking about what's going to be out on social media, what's going to be on the TV, what are people going to hear on the radio if we're doing radio ads or in a newspaper. And it's a pretty amazing process of how we're all coming together. We're working on these scripts, we're doing it together. So I'll be mentioning a little bit of what each agency is doing independently, but we're doing it sitting at the table together often. So a few of the highlights are we created a script and filmed a public service announcement about the unwinding and where to go for help. We provided feedback to DHS communications team on unwinding messaging, their website and other communications. And we have been working together to align those statewide messages that are coming from OCI, Covering Wisconsin, MKEN, and Partnership Community Health Center. And also DHS is there present at our work group and giving us feedback so that we make sure that we're not saying the wrong thing. So if we could go to the next slide. Sorry, I have some voice strain. So several groups who participate have created their own toolkits that are available to the community. So OCI, as Sarah mentioned earlier, created a toolkit and you can get there via the wiscovered.com website. MKEN created a very Milwaukee specific toolkit, and then Covering Wisconsin created a toolkit that is really a little bit more broad to be used statewide. We'll go to the next slide. Oh, and DHS had a toolkit as well that groups were able to personalize with logos. So okay, so I'm going to start with what kind of promotions have we done? And this is all April to June. So why April? Not everything started in April, but some promotions started in April. And that was because there was a lot of press going out about how people's benefits were ending. And to kind of get ahead of that panic of people just trying to go online and either renew or find something else, we started some campaigns in April and then have been building up and adding to them. So Covering Wisconsin has been doing a statewide campaign, and that's a robust campaign that's informing members about when and how to renew. But we're also doing in our campaign messages, we're trying to pull in those people who are likely not eligible anymore to make sure they're getting to WisCovered or another website that actually gets them the right information that they need to find other coverage. So there was a series of TV ads via Spectrum. This was a new a new campaign. Often we do the Wisconsin Broadcasters Association, but we decided to try something new this year because we could target particular households and incomes. So that's what we've been doing with Spectrum. A large percentage of what we're doing is streaming TV. And since I think it was mid to late April that we started, we've had over 1.6 million impressions. And those ads have a 98.4 completion rate. So the ad is playing through in its entirety. We've been able to add on with some additional, so some stakeholders have seen ads and then call and want to add in to our dollars so we can spread wider. And we were really lucky that happened, and we were able to get some rural cable TV added in. I don't have impressions for cable TV, but we've had over 6,000 airings, and that started in June. So for this particular campaign, we Covering Wisconsin was using grant funding from CMS, DHS, OCI, and UW Health. UW Health was really focused on Dane County, and that was great because that was not originally in the budget. So we were able to really add a significant amount of funding to cover that region. So if any stakeholders want to help boost that campaign and add some additional dollars, we funnel it directly to adding on how many counties we air to, how many, where's the rural cable going? Maybe we could add Dish. So that's available if anyone's interested. Another statewide campaign is a social media campaign, and this has two parts. First of all, we engaged with some social media influencers who had local followings in Wisconsin, and they made their own video. In some cases, we gave them a script of what to say, and then they posted on their social media sites. So we've got numbers from that of them just posting to their own audience. And then the other thing is we repackage that message and turn it into more of a commercial. And so we've got that going on TikTok, Snapchat, YouTube, Facebook, and Instagram. And those started largely in June. And since June, we're getting close to 1 million impressions. Oh, that's only June data, I should say. We're over 1 million now in July. So that's just for June data. Because we looked at it at a quarterly mark. And also impressive is it's led to over 27,000 clicks. So people are interested in the content and are clicking to learn more. And when they do click, they're directed to one of two pages, depending on what the content was. So if they're worried about losing their health insurance, they're being directed to the WisCovered site to learn more about other options that might be available. If they need help about how to check the app, how to renew, and need step-by-step instructions, we're directing them to a Covering Wisconsin landing page that provides them step-by-step information there. So another statewide campaign that we've had really, really good coverage with are Google ads. And this is really targeting people who are already searching with some of those keywords like health insurance, Badger Care, Medicaid, and are located in the state. So we've had over 1.3 million impressions of those ads and over 12,000 clicks. And again, those are directed to either WisCovered or the Covering Wisconsin landing page. We, as mentioned in the outreach and education REN update, we ran ads in 7 newspapers during 5 weeks in largely rural counties because the counties are harder to reach via cable or streaming TV. So we wanted to put some ads in those local newspapers that people are still reading. So, okay. Milwaukee has, as we've heard, the Milwaukee Enrollment Network. And so they were able to place 16 digital ads. They've had over 2.3 million social media impressions. They've reached over 155,000 people on social media. So reach and impressions can be different measurements. So they also placed 12 ads within local DMVs, and an estimated reach for that is over plus or minus 35,000. And their ads are really much more localized, and they're directing people to a landing page on Healthy MKE, which is specific to renewals. And their ads have all been about renewals. So, and on that landing web page, they've had over 362 people who clicked to download the My Access app, and 63 people who clicked to call Covering Wisconsin to get help. And again, this is data from April to June. So in Fox Valley, Partnership Community Health Center is very active in placing their own ads. They had one electronic billboard that was specific to renewals that had a June start. A lot of these started in June, so they do not yet have data, but this is what they've been doing. They put 2 print ads in Spanish language magazines. They've been running 2 Google Agility ads in both English and Spanish, and that's either targeting people who are looking for information about health insurance or about renewals. Oh, I didn't quite get to that slide. Thank you. And then they did also have 2 radio ads that were running. And in addition, they were very excited because they got to participate in a 90-minute radio interview, and it had people calling in, and I guess a lot of people were interested in calling in and asking questions. So it was very successful. Okay, and I'll let Kelsey cover the analytics for what's covered.
Sure, thanks, Steph. Hi, everyone. My name is Kelsey McDermott, and I'm a communication specialist at OCI, and I co-chair the marketing and promotions work group with Stephanie. So these are from April through June, WisCover.com analytics. So we've had almost 26,000 page views, and comparing that to last year, it's over a 2,000% increase. So over 71% of the visitors to WisCover.com arrived via the paid search that the paid advertising that Stephanie had mentioned. 23% of the visitors directly typed WisCover.com into their internet browser. These visitors could have seen or heard a television or radio ad or saw outdoor advertising. 3.2% of the visitors arrived via referral. So our top referring sites were the Jobs Center of Wisconsin's website, our website, OCI's, and other online articles like the Milwaukee Journal Sentinel. Next slide, please. So these are the top cities that WisCover.com visitors were from. Milwaukee and Madison were the top 2, followed by La Crosse, Green Bay, and Appleton. And of the Wisconsin visitors, almost 70% of them viewed the website via mobile device and 25% via desktop. WisCovered is a mobile-friendly website, meaning it was designed to work best on smartphones for Wisconsinites who may not have access to computer or lack internet access at home. So it's great to see that we've got almost 70% of them viewing via mobile. All right, and I'll hand it back over to Steph to covering Wisconsin's website analytics.
Okay. So as I mentioned before, some of the clicks would direct people to the Cover Wisconsin landing page. So we have seen within April to June, over 28,000 total visits to our web page in general, and over 7,000 specific to the Unwinding page. So we're pretty happy with those numbers. We don't normally see those numbers this time of year. So Something's working. All right, and then I don't have yet the official report from 211. So this was pulled from their website, which we get much more robust numbers when we get the actual report. But luckily Kelsey was able to pull those. So there have been 749 health insurance requests. And you can see compared to last year how that data compares. And so we're certainly seeing an uptick. Why is this interesting? It's because the TV ads tell people to either call 211 or go to WISC-covered. So we're pretty happy with these numbers. And the other thing that I find really interesting is where the numbers are coming from. So if you look at the map, we've got some high uptake happening in places that are not necessarily Milwaukee or Madison, which are where we usually see our biggest numbers. So we're pretty encouraged by this data. And then last, here's some of the earned media that happened, largely as a result of press releases that DHS sent out. So, okay, and that's it for the marketing worker.
Thank you, Stephanie and Kelsey. All right. So that brings us to the last piece of our agenda, which are just questions and feedback. So are there any questions or comments on the work group reports or for DHS or other feedback about the partnership work? I don't see anything coming in the chat, but I'll wait a couple more seconds just to see. All right, I don't see any questions or comments coming into the chat. So thanks everyone for all of your active participation today, listening in and learning about what our work groups are doing. Our next forum is currently scheduled for Monday, October 23rd. So, and a couple of thanks in the chat for the presenters today. So thanks everyone who presented, and thank you all again for coming.